low blood glucose, hypo, and type 1 diabetes. Key points. When you take insulin, you are at risk of low blood glucose levels, hypoglycemic, which can be dangerous. A low blood glucose is usually when your glucose is less than 4 mmol per liter. If you are getting low blood glucose levels often, or if you have had a serious low blood glucose level, see your diabetes specialist team. It is best to wear a medical alert bracelet if you are on insulin. If you don't want to wear a medical alert bracelet, carry a card in your wallet stating your name, the fact you have diabetes, and your usual insulin doses. Carry glucose or some other form of sugar at all times to treat a hypo. What is a low blood glucose level? People will feel symptoms of low blood glucose at different levels, but most people and doctors agree that your blood glucose is low once it drops below 4 mmol per liter. Some groups of people, e.g., the elderly, children, or people who can't recognize if they are going low, may be advised to keep their blood glucose levels well above 4 mmol per liter. Take the advice of your diabetes specialist team on this. What causes low blood glucose? When we eat carbohydrate foods, starches and sugars, they are broken down to glucose in our stomach and gut. They are then absorbed into our bloodstream. Once in the bloodstream, this glucose is called blood glucose. Blood glucose is circulated to every part of our body. The glucose needs to get out of the bloodstream and into our body's cells so it can be burned up for energy. To do this, we need insulin. Insulin is produced by our pancreas, and is a natural body hormone. One of the main jobs it does is to act on the wall of our body's cells and muscles to make them let glucose through. Glucose is also produced by the liver from fat and protein. This is to prevent hypoglycemia when not eating. About half of the insulin we need is for the purpose of switching off the liver when blood glucose levels are high enough. When we have type 1 diabetes, our blood glucose levels get too high because we either have no insulin or only a minimal amount. It is important to remember that it is just as bad to have a blood glucose that is too low, than it is to have one that is too high. Why? Because our brain needs glucose all the time, just as much as our brain needs oxygen. If you cut off the supply of oxygen to a person's brain, say by drowning, they will become unconscious. It is just the same with glucose. Because our brains need to have a steady supply of glucose. Our bodies are designed to make sure that our blood glucose never gets too low, otherwise we'd fall over every time we skipped our breakfast. In response to the lowering of blood glucose, our body lowers the amount of insulin it is putting out. This does two things. Firstly, it slows down the movement of glucose out of the bloodstream and into our cells, which start to keep our blood glucose more steady. Secondly, our liver recognizes that we have now got a low insulin level, and in response to that, starts releasing stored glucose that lives in the liver, out into the bloodstream. This acts to keep the blood glucose level up. So this is how our bodies normally protect us against having low blood glucose levels. All this changes when you have diabetes and are taking insulin. You can still get the same low blood glucose level if you run out of glucose coming in from your food. But when the body senses that the blood glucose is becoming lower, it tries to switch off its insulin, but it can't. This is because you have injected your insulin, and you can't switch this off. If your blood glucose is low and your insulin can't be switched off, what happens? The insulin continues to move the glucose into the body's cells. The liver doesn't start releasing stored glucose. Remember, it only does this when it senses your insulin levels are low. So, your blood glucose level keeps going down and can soon be dangerously low. The liver does not correct your low glucose. What are the symptoms of low blood glucose, hypo? Once your blood glucose is less than 4 mmol per liter, your brain starts to run out of glucose. Because this is an emergency, your body starts to react. You may feel shaky, sweaty, or suddenly unwell. Your heart racing, tingling around your mouth and tongue. Suddenly a little strange, as if you are unable to concentrate. Suddenly very hungry. Your friends may notice you have gone pale. Over time you will come to recognize the feelings you get when your blood glucose goes low. What do you need? Glucose, of course. This is why people who are on insulin are advised always to carry some glucose or something sweet in their pocket at all times. If your blood glucose is low, you need glucose immediately.